Are you aware of what acute pancreatitis is and why it's crucial to understand it? Acute pancreatitis is a common gastrointestinal condition that's been causing more people to visit emergency departments and get hospitalized. It's an inflammation of the pancreas that can occur suddenly and usually resolves in a few days with appropriate treatment. However, in recent times, we've seen a worrying increase in its incidence. And why is that, you may ask? Well, factors such as metabolic syndrome and obesity have been major contributors. With the rise in unhealthy lifestyle choices and dietary habits, our bodies are more susceptible to conditions like these. But it's not just about the increasing numbers, it's about the severity of the condition itself. Acute pancreatitis isn't something to be taken lightly. It can be severe, potentially life-threatening. Now that we understand what acute pancreatitis is, let's delve into why it's important to know about it. So what causes acute pancreatitis? Well, there are several common causes. One of the most prevalent is gallstones. These small, pebble-like substances can block the ducts that carry digestive enzymes from the pancreas to the small intestine, leading to inflammation. Heavy alcohol use is another significant contributor. Regular excessive consumption can cause the pancreas to produce toxic substances that result in inflammation. It's not a one-off binge, but rather a sustained pattern of heavy drinking that poses the risk. Then there's hypertriglyceridemia, a fancy term for having too much fat in your blood. High levels of triglycerides, a type of fat, can trigger an episode of acute pancreatitis. Certain medications can also be the culprits. Some drugs have side effects that may cause inflammation in the pancreas. Always consult with your healthcare provider about potential risks when starting a new medication. And let's not forget metabolic disorders and obesity, which have been increasingly recognized as risk factors for acute pancreatitis. Knowing these causes can help in early detection and prevention. But how severe can acute pancreatitis get, you may ask? Well, it's a complex question with a rather unsettling answer. Predicting the severity of acute pancreatitis is no small feat. There's a myriad of factors at play, making each case a unique puzzle to solve. Let's delve a bit deeper into this. About 1 in every 5 patients, or around 20%, develop severe forms of this condition. Now that's a significant number, isn't it? This isn't just a case of a bad stomachache we're talking about. It's a life-threatening situation that can escalate quite rapidly. The mortality rates associated with these severe forms of acute pancreatitis are alarmingly high. We're talking about a condition that doesn't just disrupt lives, but can actually end them. And that's a sobering thought indeed. This is why it's crucial to understand and recognize the signs of this condition early on. The sooner it's diagnosed, the better the chances of managing it effectively. It's clear that acute pancreatitis is not a condition to be taken lightly. Are there any long-term consequences of acute pancreatitis, you may wonder? Indeed, there are. One significant long-term outcome that can develop is post-pancreatitis diabetes mellitus. This isn't just your everyday diabetes. This is a specific subtype that emerges as a consequence of acute pancreatitis. It's a serious condition that comes with its own set of complications. We're talking about increased risks of cardiovascular disease, kidney damage, nerve damage, and even blindness. The pancreas, damaged by inflammation during an episode of acute pancreatitis, can struggle to produce insulin effectively. This insulin deficiency is what leads to post-pancreatitis diabetes mellitus. The body's inability to regulate sugar levels, combined with the additional complications, can severely impact a person's quality of life. In short, acute pancreatitis isn't something to be taken lightly. Its consequences are far-reaching, affecting not just the pancreas but the entire body. As we can see, the impact of acute pancreatitis can extend far beyond the initial diagnosis. In conclusion, what have we learned about acute pancreatitis? Well, we've unpacked this complex gastrointestinal condition, unveiling its causes and potential triggers, such as gallstones, heavy alcohol usage, elevated triglycerides, and certain medications. We've also shed light on its unpredictable severity, with around 1 in 5 patients developing severe forms with high mortality rates. Our journey didn't stop there. We ventured into the realm of its long-term consequences, like post-pancreatitis diabetes mellitus, a subtype that carries its own set of serious complications. Understanding acute pancreatitis isn't just about knowing what it is. It's about comprehending its full impact on a person's health and life. And that's where the importance of awareness comes in. It's not enough to have this knowledge tucked away in a corner of our minds. It should be at the forefront, guiding our decisions, influencing our actions. Because it's only when we're fully aware that we can take the first step towards prevention and early detection. Remember, awareness is the first step to prevention and early detection. Stay informed, stay healthy.